So thank you very much, members, for finding time to attend to our third seminar in medical physics. Today, we are privileged to have John, who is a professor of medical physics. He will be giving a talk on medical physics and radiation therapy. John, I think you can pick up from that point and start.
Say again?
Oh, I was saying that I think you can start by now giving us a summary of your biography.
Okay.
Oh.
We're breaking up a little bit, I think.
Are you able to, I was saying that maybe you can start.
Okay, I can start, sure. So I will share the screen. And hold it a second. Just need to get my cursors going here. There you go. Can you see my slides?
Yes.
Excellent. Good. Well, good afternoon, good evening. It's a pleasure and an honor to be able to tell you a little story today. And the story that I will be telling is continuing a discussion and an introduction to medical physics, but I will be concentrating on radiation therapy, medical physics and radiation therapy for most of my talk. So I will start, I always like to start to give a little bit of an idea of where I am at. So I am at Queen's University in Kingston, Ontario. And Kingston, Ontario is in southern Canada on Lake Ontario. So this is a pretty big lake. On the other side is New York. We are halfway between Toronto and Montreal and very close to the capital of Canada, Ottawa. So we like to think that Kingston is the central location in Canada. It's a lovely place to live, you can see. And there's one big advantage. This is the hospital that I used to work at. I'm now retired. And this is the university that surrounds the hospital. So it was always very convenient. The hospital was right at the university. And in fact, this round building here is the physics building. So we were very, very close to our colleagues in the physics department. Being in Canada, there were certain advantages that one could actually go for a walk on the lake at some times of the year when one could walk on water with nice, about 20, 30 centimeters of ice. So one of the pleasures of living in Kingston. So today I'm going to tell you a little bit about medical physics again. You had a brief introduction to that by Dr. Pittman, by Yakov, a couple of weeks ago. I'll talk a little bit about what radiotherapy is and why what's the motivation. I'll discuss the two main classes of treatment that we use, describe some of the common equipment. We'll look at a little bit of the physics of these radiation beams that are coming from the machine. And then we'll walk through what the process looks like. What does radiotherapy look like? And give some examples to illustrate the need for physics. I usually like to try and get all my slides in the same format so that it's not so shocking as you go through. But I've taken these slides from multiple talks from multiple authors, and I've kept the format of the different talks from the past. So The styles will change every now and then. I apologize for that. So again, the question might be, what is medical physics? And the short answer is the application of physics to medicine. A slightly longer answer would be that we use different types of energy and different types of radiations to diagnose and treat disease. And one can use many types of radiation in the electromagnetic spectrum. In therapy, one is usually using ionizing radiations because we are trying to kill cells, particularly tumor cells. So I will be concentrating mainly on the physics of ionizing radiation today. Although in diagnostic imaging, different other radiations are used. So where is medical physics usually applied? In the hospital, most commonly medical physicists would be in diagnostic imaging, where one might be doing X-ray imaging or magnetic resonance imaging, PET imaging, ultrasound. All of these imaging modalities are based on the mapping of some physical parameter, attenuation coefficients, proton density and relaxation times, annihilation of positrons, sound attenuation, and all of these properties can be mapped and in such a way that when you look at that map, you get an image. So this is all based on physics. Also, we can use physics for treatment of disease. And so this is what I will be concentrating on today, is how we use physics and how medical physicists are involved in the treatment of disease. In fact, these two areas have become more and more overlapped over time, in that this imaging guides much of the radiotherapy that is done in a modern cancer clinic. And one is not just doing treatment, but one is also using these imaging modalities to inform how to better do the treatment, and perhaps to follow up how the treatment is progressing as the patient is going through their care. So if we ask, what is radiation therapy? Radiation therapy is the use primarily, of ionizing radiation to treat patients that have some disease. And the most common thing that we are treating is cancer. And if you look at the distribution of sites in the cancer clinic in Kingston, which would be quite common for a North American center, we're treating cancers in the chest, lung, predominantly lung. We're treating in the pelvis, prostate cancer for males, cervix cancer for females. We're treating in the head, in the neck. So that we're treating sites all through the body. Cancer is the main disease that we try to treat, although there are some other diseases. And just to give you a feel for how important cancer is, I will just give you some current Canadian statistics. So Canada is a country of about 38 million people. And in Canada, about 230,000 people will be diagnosed with cancer this year. 2 in 5 Canadians, so about 45% of men and 43% of women in Canada, and I think this is quite common in much of the world, are expected to develop cancer sometime during their lifetime. So it is quite a prevalent disease. But many of these people will survive, and only about 1 in 4 Canadians die of cancer. So we do have a lot of success in our treatments, and our treatments are quite effective. In fact, if you look at how cancer has changed, if you look at the incidence, how many people are actually experiencing cancer, you can see that for men and women, the incidence has been relatively flat, perhaps increasing a little bit, mainly because we have gotten better at diagnosing the disease. So some of this increase isn't that there is more disease, it is just because we are getting better at actually diagnosing the disease. But if we look at mortality, people who are dying from the disease, with time, that has been decreasing. And that's because many of our treatments, including radiation therapy, are quite effective in treating the disease. In Canada and in much of the developed world, and what we think should be the case for all the world, at least 50% of cancer patients will have radiotherapy at some time during their care, during their the course of the treatment of their disease. So radiotherapy is one of the